Dr. Maddocks. I wanted to know how to travel safely as safely as possible. Is it advisable to get certain vaccines for travel like yellow fever? I plan to travel to Europe via plane and cruise. They say that there's stage 3 non-Hodgkin's follicular lymphoma, getting treatment every 8 weeks.
So this is a great question, and I'm probably going to answer this a little bit more generically because I think that it can depend a little bit as far as what specific vaccines. But when thinking about travel, I think that it's a good idea to look at where you're traveling because both where you're traveling, time of year you're traveling, and what you're going to do when you're somewhere can depend on what vaccines are recommended. I usually advise patients to consider looking at the CDC guidelines for recommendations for what should be received in that area of travel that time of year, what they're going to be doing. And then sometimes there are places that will actually have a travel clinic. Once I know what vaccines are recommended, the patient knows what vaccines are recommended, then I usually work with them in pharmacy to decide what vaccines, if they can receive all those vaccines, or if there were certain ones that we may not recommend. In general, it can depend on, a patient, what treatments they've received, or if they're actively receiving treatments. But, in general, we like to avoid live virus vaccines in our patients. So I kind of take into all those factors and then would recommend discussing the specifics with your physician.